welcome to In the Hot Seat with WRP, where our mission is to inspire entrepreneurial thinking through engaging conversation. Today, we have a special guest who has built a thriving dental practice from the ground up. He loves to brighten your smiles. With no further ado, I'd like to introduce Dr. Daniel West. How you doing, Dr. West?
Doing well. Excited to be here.
Great. Well, for the viewers and listeners, tell us about your background. How did you get to where you are right now? How did you become a dentist?
Well, I'm from Tennessee originally. I knew I wanted to be a dentist since I was in high school, actually. So it was more about figuring out how to get there than what I want to do. I'm fortunate in that aspect, I guess. I didn't have to try something and not like it and go to the next thing. I already kind of had a plan. Problem is I just didn't know how to get there, and nobody was really around to tell me. So this is pre-internet days.
Okay.
So, getting course catalogs through the mail and waiting for that to come through and try to piece it together and go talk to someone who might have done it, to try to get, their path and see what it took for them to get there and see if it's something you can do or if it'll work for you is kind of how I had to piece it together. And ultimately, I didn't really even know what all it was going to take when I decided that's what I wanted to do. The more I looked into it, it was a bit intimidating, just the length of time in education, but I stuck it out and made it. So,
did you ever work in corporate America before becoming a dentist?
No, I did corporate dentistry, but not, my private practice. So, it's a little different. I didn't go punch a clock. I was still a commissioned practitioner. So it was, they attempted to run it where it was my business within their business for tax purposes for them.
Yes.
Which ultimately I was an employee and all the benefits were going the wrong way.
Okay.
So it's, but much different, in dentistry, as far as having a private practice of your own versus being part of the corporate dentistry algorithm, because it's not really patients in that setting. It's insurance numbers and procedure codes.
Gotcha.
Yeah.
Okay.
It's all about, morning huddle production number. How do you get to that number? Not taking care of Mr. and Mrs. Jones because they have a problem. So I knew that I needed to get out of there. The problem with that is they do a good job of making it very easy to stay.
Gotcha.
It's you go in, you show up, you do a little work, you make some money, and you go home, and that's the end of it. Whereas in your own practice, I have an answering service. There's a patient has a problem, they give me a call. I can meet them at the office. So I don't have a ton of that, but with corporate dentistry, it was complete 8 to 5. It's when I left, I was done until the next day. Yeah.
How long have you been in private practice?
7 years.
Okay.
Yeah.
So when you first started, did you find out that it was easy? Did you encounter any challenges when you first opened up? Because I know when I met you, you told me that you had a colleague who wanted to go and practice with you. Could you share some of that story, how that came about?
So a gentleman, I won't mention his name, worked with me at the corporate dental office. And it was multiple offices around town, and we kind of floated to different offices every day of the week. And we knew we both wanted to get out. And I'll shorten the story a little bit as far as how we came to that decision. But ultimately, he got out first and wanted to start a multi-dental specialty practice. So he wanted to do oral surgery, me do the periodontics, bring in an orthodontist, an endodontist, and so on. And we all kind of practiced out of the same place, kind of a one-stop specialty shop.
Okay.
There was 2 problems. The first one was the gentleman was actually not a specialist. He tailored his practice where all he did was basically extractions, but he really wasn't a specialist. No knock on him. He was great at exodontia, has done very well for himself, at least up to that point that I know of. I don't know much past that, doing that. But ultimately, it made it more difficult for him to try to have a specialty practice because as a specialist, you get referrals.
Okay.
And part of the reason doctors refer to you is because you're only going to do your specialty And then, because the ADA really want to allow you to expound on that.
Okay.
If you're not a specialist and you do that, you could really keep the patient because you're a general dentist. So general dentists will be a little reluctant to refer that work out because the patient may never come back if they like the office. So he kind of had that hanging over his head. The other thing is he wanted to, in my opinion, and hey, some people like to go this way, they go big or go home or, things like that. But I felt like he wanted to start at the finish line, if that makes sense.
He didn't want to crawl before he walked.
At all. He dead sprint, already breaking the tape that he won. He wanted an office more so that was a status of he had made it, in my opinion. And ultimately, he found a space that was entirely too large, in my opinion. Again, it was double the size that was really required. And the lease on that was going to be, and this was, 9 years ago now, $19,600 a month.
Wow.
That's just the lease. He also borrowed close to $2 million to build out working capital, equipment, everything for this space. And that was about a $20,000 a month debt service on the loan. So those two things alone were $40,000 a month before you pay labor, insurance, materials, marketing, paid yourself, all these other things, utilities, internet, phones, what it takes to run a business. You're already $40K in the hole. Exactly right. So I wasn't comfortable with that. I had a better idea for myself that I wanted either start very small and build up and grow. If I couldn't do that, I wanted to buy an existing business that I could find that was undervalued and then grow that. And ultimately, it was the second one that I came across, and it put me in a much better financial position starting than had I went into business with this gentleman. Hope he's doing well.
Yeah. I mean, imagine if you had, took that route. You'd be in a hole right now, probably.
I'd still be digging out. It's $2 million is a lot of money.
That is. Go big or go home. Wow.
The part that scared me the most, it's not that you can't make money in dentistry, because you can. I mean, that's a fact. But when you start an office from scratch, you get all this granite countertops, brand new equipment. The whole place is beautiful, And you come in and you get your employees and you sit down and you all stare at each other. Phone's not ringing yet. There's no patients on the book yet. You got to pay that loan, but that loan's due immediately. Rent's due at the end of the month or first of the month. But you have no business yet. So you're starting with all the expenses as if you have a up and running practice, like you're mid-stride, like you're generating, $120,000, $150,000 a month, and you actually have no patients yet. So he was really burning through the working capital just to keep the place open until he could try to market and get it out. It was a little bit backwards in my opinion.
Yeah. Well, aren't you glad you didn't go that route?
100%.
Okay. When you started your business, did anybody ever teach you about taxes? I mean, because that's a big,
It is
deal with
humongous.
businesses. They don't take an account. You got employees, you got payroll taxes, you have so many things that you don't think about. It's not just the money that comes in, it's all the incidentals that you don't think about.
You need to repeat that. This is going to come as a shock. Maybe. I don't know. You've been through it. You maybe not. I found out that I was responsible for half of my employees, basically Social Security taxes, when I ran my first payroll. That's when I found out. So
I'm like, what is this?
yeah, exactly. Like, and when I say I ran my first payroll, I didn't do it by hand myself. I bought an existing practice and I kept the exact same company, but then they sent me a breakdown of what was coming out of the account and where it went. So wanting to learn about my business I had purchased and kind of understanding the money of it, I went down line by line, and that's when
It hit you.
yeah. And, thanks to the internet, because I didn't want to pick up the phone and sound,
Stupid.
exactly right to my accountant. I started researching, and I was like, oh, okay.
I'm responsible for this.
Yeah. And now I understand better why the corporate place I work for wanted to list everybody, all their practitioners anyway, as independent contractors. Because then they just pay you the commission based on your production, and it's up to you to cover all your own taxes.
Absolutely.
So they essentially were saving that half, of your 7.5% or whatever it comes out to be, because then I was responsible for it, not them.
But you sort of really appreciate it after going through it because you can sort of give back or enlighten future dentists about, going into business on your own.
Yeah, I've got a lot of opinions on it, and I've talked to a lot of people wanting to go into business for that. Kind of the same route I took. They got out of dental school and took a corporate dental job because the dental school is almost like sharks.
Yeah.
Because they got to have bodies, and then you get in there and you realize it's really not for me. And what do I do? And I kind of lay it out. You can do this, you can do that. This is what I did. This is why I did it. I have friends and individuals that went other routes. Some of them were successful, some bankrupt, back in corporate dentistry. A lot of different things. And ultimately, I can only tell them what worked for me. But at the end of the day, it's about how hard you want to work to keep that business open and market that business and build the relationships that it's going to take to keep it thriving.
Okay. Do you consider yourself a business owner or an entrepreneur?
Business owner, 100%. Entrepreneur, more of an original idea. You kind of, I didn't reinvent the wheel. What I do and how I run my practice has been around for, 60, 70 years. I bought a practice that had been around 30 years when I bought it.
So I had existing book of business.
Correct.
Okay.
Yeah, it's a different challenge though, because I bought a business from a gentleman who had built relationships with people over 30 years. And then he literally kind of pitched the keys at me on the way out the door.
And now you have to cultivate those relationships to keep it going.
That is right. Not only the referring doctors, but what I do also has kind of a built-in what we call hygiene recall. So you kind of capture a patient and then you help treat the patient. And for their oral care, I'm not doing surgery every time they come, but we follow up on it and make sure that it's holding up. So they alternate their hygiene cleanings through my office. So he had been building that, and that's a pretty decent amount of money. So you don't want to lose it and have to build it over. But you have to convince those patients that they're going to like you too.
Absolutely.
And people don't like change.
Yeah, I'm sure you went through that, period, I got to get them in here, hope they like me, so.
Yeah, it's scary, because when you're trying to buy an existing business, you look at some things, even if you don't understand business, which I didn't, because you go to college for biology with a minor in chemistry, then you go to dental school, and then if you go back and be a specialist, you do your residency and, with a simultaneous master's in oral biology. Not one class was business. Zilch. I hadn't seen an actual ADA claim form until I ran my own business.
Nothing about taxes either.
No, not at all.
Yeah.
No. The only thing they would even say to you in those programs is, Bank of Financial 100%, don't worry about it. Which is true. They will, because it's such a tried and true business model that they know as long as you show up and do work, you'll make money. And it's a safe bet on their part. Banks, when they loan money, it's a risk. It's a gamble. And they say, I'm going to risk this much money for this much return on you. And based on how risky this is how much I'm going to charge you for this money on your interest rate. And that risk might be that you're a poor paymaster based on your credit score, or that your idea is a little shaky. But if you're coming out of dental school and you got these degrees and you're taking up an existing business that's been making money for 30 years and it's undervalued on the cost, it's a no-brainer. They'll throw the money at it.
Yeah.
So that wasn't a problem. in that aspect. But it's just that loan still has your name on it, you know, and it's still hanging out over your head. So every day you get up thinking, I got to get to it.
Got to. If I don't, yeah, my staff, how they gonna eat?
Yeah.
You have staff that you're responsible for.
That's a whole nother animal right there. That's when you run a business, you are responsible not just for the people there. They're dependent on that check to go home and support their family.
Absolutely.
So by extension, you're taking care of them and their family. If I belly up, then they got to go figure out how to make money and pay their rent, their kids, tuition, put food on the table, keep gas in their car. And some mornings you wake up and you're like, I don't feel like doing it, man. I'm tired. I had a bunch of stuff that I've been putting off, and I thought this was the weekend to do it, and now I feel like somebody beat me on Monday morning, because I didn't.
So what keeps you motivated? What keeps you going?
It's a couple of things. I'm fortunate that I do like what I do. So that helps for sure.
Okay.
And I know that this maybe sound a little bit selfish, but if I take a day off, it's not just, hey, like my employees, if they take, maybe I should put it this way. If my employee takes a day off, I'm tired or kid's sick or whatever, and they're gone. They'll pull out the form, fill it out, comp time. It's like they were there. They make money. If I don't show up, I got 6 people filling out a form for comp time. I lost revenue for that day. So it's not only that I didn't make money, it cost me, XYZ dollars every day that I don't want to take off. And that even pushes to like vacation. I don't take really long vacations because every day that I'm out on the beach enjoying myself, I know that when I get back, even though no money came in, I got to write a check, for like $1,500 for every day that I wasn't there, just to cover, what I was missing. So that kind of hangs over your head, and it makes you want to be there. Number one. Now, I'm not going to say it makes you a workaholic or anything like that. Like anything else, if you plan accordingly. I wrote rules into my employee handbook that employee vacations 1 week has to coincide with mine, and things like that. So at least if I'm paying that, it's coming off their comp time. And at the end of the year, I don't have to pay them out because they didn't take time. And then so you have to kind of plan those things, and you learn that along the way. Nobody tells you that. Little tricks, that kind of make it a little easier to swallow some of the money. Like Memorial Day's coming up. We're off on Mondays, but we have a paid holiday. So we just take Tuesday also. That way on payroll, I'm still only paying 4 days, not the holiday in 4, which is 5, which is more than I would normally pay. So the employees like the extra day. Everything is the same on my books. So I don't feel an increase because of that extra day. But again, those are things that you kind of figure out along the way. Another one is twice a year. People probably don't think about this if you're an employee, but twice a year, there's 3 payrolls in a month. So usually, you get paid every 2 weeks, so you figure there's 2 payrolls, a month. But twice a year, there's actually 3, is the way that works out. So if you're figuring that's a 50% overhead increase on labor for that month, twice, so if you're not planning for it and something incidental happened, or you thought, hey, we're looking pretty good, I'm going to do a little something extra. And then that next month is there, he's like,
I mean, as long as you plan for it, you'll be fine.
That is the key. That is the key right there. A little foresight and planning and working your plan. You can plan all day, but you got to work that plan.
Absolutely. Absolutely. Okay. Nutrition. How does nutrition play a part in one's oral health? What types of tips do you give your patients about nutrition if they're coming to see you? And let's just say they have a jacked up mouth.
Yeah, well, we get a lot of that. So, I will answer that the best of my ability. As far as I don't give a ton, because as a specialist, they've already come through the general dental office.
Okay.
And they get most of that counseling there.
Okay.
By the time they get to me, it's a really specific problem, and I kind of stay in that box that the dentist can't take care of, so they send them to me, and then I do it, send them back. But at the same time, one of those things is what we call flap and osseous surgery, where if you don't take care of your teeth, you can lose a lot of bone, ultimately lose teeth, and patients will come in, it looks like a bomb went off. You know, that's not great. You know, sometimes we would call it calculus, you would call it tartar. So much tartar that you can only see the tips of the teeth sticking out of it. And I tell the patient, when I clean all this off, you might lose 3-4 teeth. They're all going to be loose. And then we'll be able to see what's going to happen. And then I don't try to, browbeat, patients.
Yeah.
Because you'll run patients off.
Yeah.
I always say that I work with patients.
Yeah.
Like, hey, I know how you got here because this is what I do. Mm-hmm. But I want to try to help you not get back here because I can clean all this off, get you somewhat stabilized. But if you don't change anything, you're going to be right back. And this time it'll be 3 more teeth you lose. And, that happens enough times you won't have any teeth. So obviously the obvious things with dentistry is, high sugar diet leads to cavities. It's also an inflammatory thing. I'm a gum surgeon, so I focus more on the gums than the teeth. Mm-hmm. But the health of the gums is basically managing inflammation. So anything that would antioxidant-wise that would help with inflammation reduction, so you don't get chronic inflammation to bone loss, would be beneficial. And it's just kind of common sense. If you sip on a soda all day long or sweet tea, you're gonna have cavities. If you chewing a bunch of sticky gummy candy 24/7, you're gonna have cavities. If you eat and go to sleep, and don't brush your teeth, you're gonna have problems.
Flossing also.
Flossing, you got to be the boss of floss. There's a bad joke in dentistry that you don't have to floss all your teeth, just the ones you want to keep. Right. Right. Obviously, you want to keep them all. You have to floss. It's imperative. You could almost skip the brushing, and I'm not advocating that. But if you just flossed your teeth, you would maintain a level of oral health probably better than if you brushed them. And that's my opinion. And the reason I say that is the bulk of your teeth have what they call self-cleansing areas. The flat surfaces out, what we call labial, out by your lips. It's getting hit by your lip all day. It's wiping it off. The inside by your tongue, you're talking, you're wiping them off inadvertently. But between the teeth, exactly. So, and that's where bacteria, that and down in the cracks and crevices of your occlusal surface, and the developmental grooves and things. That's why sticky gummy candy, gets down in there and you get these pit and fissure cavities. But you should do both. I'm not saying floss and you'll be okay and brush. I want to make sure that's clear.
Yeah.
But it's paramount that you have to floss. The bacteria you leave behind is just phenomenal. There's a product out there, and I won't call its name, where basically you stick something between the gum and the tooth, let it soak up what's known as gingival clavicular fluid. It's just, fluid between the gum and the tooth. And then you culture that. Or you can immediately put it on a slide and show the patient how much bacteria is coming out between the gum and the tooth and between the tooth. Wow. Living organism. And it usually blows people away. And then they say, oh, but if you have this product, you could kill this. So, because it's business, obviously.
Yeah.
But the fact is still there. If you're not breaking that aggregate of bacteria up, then it's going to come back to get you. And it's mainly, I don't want to get too scientific, but it's anaerobic bacteria, which meaning, they don't like air. And what happens is they get between the tooth, and the ones on the outside kind of die from the air, but the ones on the inside then have an oxygen-free environment, and they proliferate. And their byproduct, just like your body, if you go and you work out all the time and you deplete the oxygen in your muscle, well, your muscle doesn't stop working, right? You keep on doing it, and then you go from, the electron transport chain to produce energy to fermentation. The byproduct fermentation is lactic acid, and then you have sore. So they say, oh, you got lactic acid in your muscles, you're sore. Well, these bacteria do the same thing, except they only do fermentation. So their byproduct is lactic acid. And that's what demineralizes the enamel of the tooth and creates cavities. So if you can break it up with the floss, let air in, and then you'll do yourself a lot of favors.
So there is a correlation between one's oral health and one's overall health, would you say?
oh, that's a fact. That's not even my opinion. Even just for what I do, inflammation in the gums is a risk factor, an increased risk factor. Well, say chronic inflammation in the gums is a risk factor for hypertension, atherosclerosis, diabetes, heart disease, arthritis, and Alzheimer's. And that's just what we can prove. Many tests. I mean, this is old science. This is not even breaking news. Some of my referrals come from cardiologists. You know, where their patients come in, they're like, yeah, you got to get this under control because you're having a hard time. The same bacteria that you find in atherosclerotic plaques are the same ones that you find in gum disease, you know. Yeah, so it's very important. Pregnant women, preterm, and low birth weight. You know, if you don't take care of, you know, your oral health, it's your entire body. I like to say that the mouth is the gateway to the body. You know, so it all starts here. To this day, I can't figure out where along the line in this country, and maybe others, I don't know, this is one I know because I live here, that someone decided the mouth wasn't part of the body. It needed its own insurance.
Yeah, that's...
Think about it, right? If I hurt my hand, I don't say I need hand insurance. If I
never thought about that.
Hurt my foot, I don't say, oh, I need that foot insurance. But if I have a problem with my tooth,
you need dental insurance. I never thought about it like that.
Why is it not medical? It makes no sense, right?
None whatsoever.
And someone tried to tell me, oh, you could lose all your teeth and you could still live. So I can lose both my hands and still live. You know, if I get diabetic, they'll take my foot. I'll still live.
Still live.
Yeah, so that's not an answer. But at what point did they say, yeah, it's medical? That's not medical. You know, it's not part of your body. It's stupid to me. I don't understand that. But it's the system I work within. So, I mean, you know, I go with it.
Okay. Pediatric dentistry. Give us your thoughts on pediatric dentistry and if parents can get their children to a dentist early on, how it will make the process much easier down the road.
Oh yeah, that's you could have a whole show on that, man. First thing, as soon as you can see a tooth, they need to go to the dentist. 6, 7 months old, and they start peeking through, make sure it's straight. You know, people think, oh, those teeth are going to fall out. It doesn't matter. They get a whole nother set. No, that's terrible thinking. The first thing is with deciduous teeth or, you know, baby teeth, they still have a live nerve. You know, patient, which is child. The child can actually have a lot of discomfort, pain if you don't take care of that. It's usually self-inflicted and when I say self-inflicted, bad parenting. I say that out loud. Yeah, it's, you know, this kid's not going down the store and buying, you know, at 3 years old, you know, and buying a bunch of sugar daddies and right. Yeah. So they can only get what their parent gives them, right? And let them go to sleep with the bottle in their mouth because they were quiet, you know, and then they get this, it's called bottle rot, will decay all these teeth. And then the child has to suffer through that. And then if you get into that situation and you have to go in and make some type of restorative or corrective action, that becomes a traumatic event to that child, who then going forward thinks dentist, bad. I mean, it creates a dental phobia. And now as an adult, they're more reluctant to go because they had a bad experience early on. So if you were getting to the dentist early, as soon as you saw teeth and taking care of problems before they were huge problems, or learning from the dentist, hey, you know, everything looks good, make sure you're doing this, and keeping, you know, part of the pediatric dentist, their job is to keep the parents coached up and informed and know what to do. Then these kids come and go from the dentist and there's no problems, and I'm not afraid the dentist is great. You know, the guy comes in, looks at it, they polish me up, tastes like mint, give me a high five. You know, I get a toothbrush instead of a candy bar when I go to their house, you know, for Halloween, which is a joke, you know, but nobody wants to go to their house because they're not giving out candy, but, you know, they're not afraid of it.
Yeah.
So then when they have a problem, they don't sit there and sit on it till it becomes a huge problem. Because like anything else in life, if you ignore it, it gets worse, right? So like a little twinge, it'd be all right.
Yeah.
The next day, a little worse.
And speaking of that dental phobia as a child, do you encounter any adult patients that have dental anxiety?
Every day, you know, and they'll always tell me it started when they were a kid, though. You know, oh, I had a bad experience when I was a kid. They didn't really use enough anesthetic. You know, the dentist had to pull a tooth when I was, 15, and he stood on my chest. And I hear it all. Right. But almost always goes back to a traumatic event in their childhood. But if I had to guess, 35% have some type of dental phobia.
How do you deal with it?
Sometimes it's tough. We do offer IV conscious sedation. So if it's so bad that they just can't, we can help them relax therapeutically, chemically, and not remember much of it so they won't have a bad experience and worry about not coming the next time. I had one gentleman, he would already be crying. And he's probably 35, 40 years old.
Crying?
Huge tear. Not know like I'm misty, like bawling like he just lost his mother, just coming down the hallway. He hadn't even got in the, like, hadn't even made it to the lobby. He already knew he was coming. That's how deep his phobia was. And he could not do anything. We would give him, an oral medication to, get him somewhat calm, just to get him in the chair, then put an IV in, and then, Versed, fentanyl, just to be able to do the work. This guy absolutely afraid and wouldn't come. His wife was making him. It's like, absolutely, like, I know I'm good. I'll be all right. And she like was forcing him to come, or he wouldn't have came. That's how scared he was. It's a real deal. It's a real phobia. Most people aren't that severe. Most of them, I try to calm down through education. I explain everything, what I'm going to do, why I'm going to do it, why it benefits, what they can do to help me. So the first visit with me is a consult, and it's almost like going to school. I always make a joke. It's like, now that you're periodontist, we'll go do this together, and I'll charge you half price, because you're going to do half the work, because you know as much as me about it. And it kind of lightens the mood. There's certain things you don't say, in an office, in dental setting. We don't have any needles. We have syringes. It's not going to hurt. It's going to be some discomfort. It's just little things that you can do, trigger words that you avoid. When I get my syringe, have my assistant hand it to me below the patient's eye line, and I keep it below here till they see it, and then I obscure their vision with my hand as I come in so they don't see, the needle. It's all those things to try to minimize the anxiety, because ultimately that's what it is. Because once the patient's numb, usually the phobia goes away. Because at that point, some of them go to sleep in the chair, lean back, they don't feel anything. Got the radio on, and they're snoring, sawing logs. But generally, we can manage most cases without, sedation. But it's an avenue that if you can't, you can still do it.
Okay. How has technology improved your job as a dentist?
Oh, just like every other business in America, technology drives innovation and it changes everything. Just a quick case in point, we do a fair amount of dental implants. And dental implants, titanium screws down in the jaw, takes roughly 4 months to integrate. You have to test it and make sure it's strong enough, and it has integrated before you put a crown on it. It used to be that you would take a wrench and try to unscrew it. Yeah, you can put it in with a wrench. It's an implant. Yeah, it's like a little mini socket. It's pretty funny. So most of the men get a kick out of it when I'm socking it in. But the time's passed, and you want to make sure it's strong enough to support a tooth. It used to be that you would then, like a ratchet, you can flip the thing and it'll ratchet unscrew, right? But it has the little torque bar and measures torque. You would try to unscrew it up to a certain amount of torque, and if it didn't come out, it was successful. But if it did turn before it got to 30 Newton centimeters of torque, you just ruined it. You got to start over. Looking back now, you're like, why would that be the test? But every dentist has placed implants through that time. Collectively hold our breath when we try to, reverse torque test an implant.
Yeah.
Now it's a device that you actually screw in the top of it, just like you would the parts for the tooth, because the implants will accept fixtures. And it has a little magnetic ball in it, and a machine will then oscillate that ball inside of it, and that creates magnetism in metal, creates an inductance. It reads that inductance, does an algorithm, and gives me a value and says, hey, if it's above this number, it's strong enough to support a tooth. It's integrated. It's called an implant stability quotient. So at this point, I never have to hold my breath again and ruin implants. If it's below the value, then I can try to say, hey, some people heal slower. You might be, diabetic, some kind of systemic issue, autoimmune. I'm gonna give it 2 more months and then test it again, and then you didn't lose the implant. Instead of taking it out, grafting, waiting 3 months, put it in, waiting 4 months. So it's 7-month reset to try again when I could have just added 6 to 8 weeks based on this number. And that's just one thing technology's improved. Another one is we do a procedure known as they call it vertical now. We used to call it indirect when I was in school. Sinus lift. Basically, if you're placing an implant and your sinus is pneumatized and there's not enough bone for the implant to go in without going into your sinus, you can then push the floor of the sinus up and allow the implant to rest in that area that you grafted with bone at the time you place the implant. And it used to be pretty archaic. You would drill short of the floor, and then you would take this thing known as an osteotome that basically was like an offset little spike, and you had a Teflon mallet, and you would hammer and try to infracture the floor of the sinus up. Then you would pack a column of bone, push that under the membrane, and keep lifting it with that column of bone until you had enough height, and then screw your implant in. Well, if a patient sees you come at him with a hammer,
yeah, they're going to freeze up. Yeah,
right, yeah, exactly.
I am too.
Yeah, and it's not a soft tap either. Sometimes, cortical bone can be tough, so you're like, you really got to go at it. I hadn't used an osteotome probably in 5 years now to do an indirect sinus lift. I use it's a set of burrs that basically you drill to the floor just like you normally would, but then you run it counterclockwise in an electric handpiece so the flutes no longer cut. They'll push. I don't know if you've ever tried to put a screw in and you had your drill turned the wrong way, and it's like, man, it won't go, and it just seems like it gets hot and burns. Right. Exactly. Same concept. The screw, the drill going the opposite direction won't cut. But what it does then, it pushes bone, it compacts it on the sides and, on the end. So if I get that space, I can push, and it will expand and push that up instead of me tapping with a hammer. And then it's just a lot lighter pressure. I just kind of run it. It's running at 1,200 RPM, hold it there, and then I can, there are laser markings on it so I can see, millimeters. Exactly. I can see it give, take it out, stop, put a little bone, push it, give. And now I'm no longer hammering at somebody's face to advance the floor of the sinus. And it's much faster, because every swing you think, if I hit too hard, I'm going to perforate the sinus, and we got to stop, fix that, and then wait. Here, I've never even entered the sinus to tear the membrane. I'm just pushing, and as long as I keep my marks at that level, and I know I'm only pushing bone, I know that won't destroy the membrane. And it's the confidence level and speed of it are just dramatically better.
Okay. Teledentistry. What do you think about that? Or how can teledentistry work? I'm just trying to figure out,
It won't work for me as a specialist. Short of maybe a post-op, or if the patient had a question because they were, I got to get in, doc. This is all wrong. You did this surgery and send me a picture, or we got a video chat and let me take a quick peek. You don't need to come in. This is normal.
Okay.
Just reassurance for me that one. As general dentistry, you can do some things. I mean, if the patient has pain and you come on, and especially with video, just telephone's one thing, but if you can, what do they call? I don't have an iPhone, but what do they call it?
That FaceTime.
Yes. You can FaceTime, or we use the Android version, or WhatsApp, or whatever video, and you can see. An abscess is pretty awesome. They come on the screen and their face looks like, somebody slapped them with a 2x4 on the left side, and they pull their lip down, and you can see, the head on the abscess right there. You can go ahead and get them on pain med and antibiotics even before they get to the office, because it might be 3 days before you can get them in, and they have to suffer. So you can at least start having them feel better you know, but obviously you can't do a filling through the phone or pull a tooth through the phone. But as far as managing infection, things like that, or some of the things, even before I come in the room, just from the history that was taken and things, with a certain degree of accuracy, I already kind of know what's going on. Not everything, obviously, but it's pretty routine. And if you check all the boxes, you can almost do it without seeing them.
Gotcha.
And for those things, especially in general dentistry, managing infection, post-op complications. My biggest one is patients are so afraid they're going to bleed to death through their mouth, which is probably not going to happen. I mean, it's not going to happen. It's because I'm not going to sever an artery and then let it be. You know, if it was that kind of complication that happened, I would take care of it then and there and then monitor them closely. But a little blood and a lot of saliva looks like a lot of blood, you know, and that scares people. So they come in for bleeding complications, and we like, everything looks fine, you know, and we just plug them in, reassure them. If I could see that, I could save them a trip, because some of my patients come a long way. I mean, with a referral-based business, I have patients Macon, Woodstock, and I'm in Tucker, you know, I mean, all over the city. They come over, so if I can save them, you know, an hour each way, 2-hour round trip to tell them you're fine.
Yeah, that makes sense.
Yeah, why not?
Has the community been supportive of you?
Yeah, it really has. When I took over the practice, like I say, it's referral based, so I immediately had to go meet all the dentists and, you know, convince them that I wasn't, you know, a derelict and I wasn't going to, you know, hurt their patients. They continue referring to the practice. And I didn't have anybody that pushed back. Actually, I had several that said they didn't like to refer to that practice because they didn't like the guy I bought it from, and they'd be willing to give me a try. And I have retained all of those.
Okay.
So it's, as far as businesses go, I've really been lucky. The gentleman that I purchased it from was ill, so it was a fire sale. And I guess it sounds like a lot of money, but for buying a business, I bought the business for $150,000.
Wow.
Yeah, it's, you know, I could have put it on some credit cards. I didn't, but you know. And when I bought it from day one, it was doing $610,000 gross revenue. So if you look at the multiple on that, I mean, it was a steal. And I've grown it substantially since then.
Being in the right place at the right time.
Timing does have a lot to do with it, 100%. The other thing is you got to kind of know your market and what you're getting to. I knew I could grow that practice. Matter of fact, the one reservation the bank had for loaning me the money, and I told them, if you can loan it to me, great. You know, I'd rather go that route, but if you don't, I'm still buying this practice. You know, I'm not letting it get away. Was they said, oh, we looked at the financials, and the last 3 years, the revenue has declined. That's a dying practice. I said, no, the gentleman found out he had cancer, and it's cut his days back, and is going to, you know, and he's not working as much. That's why the revenue's going down, not because there's no referrals, the work isn't there. But if you don't want to, you know, fund it and make interest and maybe get me equipment loans and things like that and have a relationship and a partnership here, I'll do it myself, or the bank across the street will. You know, and ultimately they saw it my way and gave me the loan, and I've used them for. I purchased a building, moved my practice into that building. I use that same bank, you know, and it's become a good relationship, but it was a little touch and go there for a second. Yeah.
Okay.
Yeah, they wanted me to spend more money on another practice, and they go, we'll give you 100%. You know, this one, the revenue's stable. You know, you should be looking at this one. And I was like, no. And now I do more revenue than that one with, you know, and the other one was $950,000. So for $150,000 up front, I'm doing the same revenue, you know, and I got there within 3.5 years.
Wow.
And one of those was a pandemic year. So
wow.
Yeah,
Amazing.
But it's all about marketing. And, you know, every day I came in for the first, you know, year and a half. How do I make this practice better? You know, I got to meet everybody. I got to do doctor lunches. I got to, you know, I knew I didn't want to come in and, I'm going to add all these procedures and I'm do these things that, you know.
It's a relationship business.
Business is relationships. I preach it all the time. My girlfriend's a real estate agent, and when she was going through the thing, I was like, look, You're going to be running your own business, but it's all relationships. The dollars and cents, everybody thinks that's business. It's not. Convincing somebody to put their money down for your product or your service is if they like you or they want to do business with you, and that's a relationship.
Exactly.
You know, because if you're the only game in town and people don't like you, they'll go out of town. I mean, they'll come in like until they find something else, and then you're done. You know, they might, okay, yeah, but I'm looking, and as soon as I find someone, first thing smoking, I'm over there. But if people like you and you do a good service or you offer a good product, you don't really have to push that hard. You got to make an effort. I'm not saying, it's
Just keep nurturing the relationship. And that's the key.
Yeah.
You can't meet somebody just one time.
That's right.
Okay, start sending me business. You'd be like, well, dang, Dr. West hasn't sent me anything yet. Grow it. Stop by. See what he's doing. You know, let's go grab something to eat. What are you doing afterwards? You have to
doctor lunches.
continue
That's
to
right.
build it. And a lot of people don't understand that.
It's probably the most important thing that they're not teaching in dental school. At least, maybe I shouldn't say dental school, specialty school. Because dental school, you can go out as a general dentist and sign up for, 35 different insurance plans, and the phone will start ringing. And because, I found you're on my plan, you're close to the house, or I can't go here, but you take it and I want this discount. So, and that's kind of the corporate dental model, is they sign you up for every plan under the sun, and they spend all this money in marketing. So, when I say it's an algorithm, it is 100%. They say if we're with these many plans, we should get this many calls a day. If we get this many calls a day, we should be able to schedule this many patients. This many patients, insurance on first visit will pay for these 3 things unequivocally, no ads. So we should at least generate this much money. As a dentist, people are going to have problems. You're going to find these problems. You should schedule these in this port, so an extra 15, 20% per day. It is amazing the math they put into this. And then they come in and be like, okay, we're not hitting these numbers. Where do we fall short? You're not calling enough people back at the front desk. We didn't send enough mailers out this time. They will work that problem to see where they've lost in this algorithm and rectify it and keep it going. Because to them, it's a money machine. I was told once that if I found a machine and I put a quarter in it and I turned the handle and 50 cents came out, they said, you never move from that machine until you're out of quarters. And, because you stay there all day. And that's how the, corporate dental looks at this. If I take these plans and I put this much money in marketing and labor overhead and lease space and things, I'm going to get this much money out every month. And I'm going to stand here all day and turn this knob until 2 quarters come out for the one I put in. And if I turn it once and only 1 quarter comes back out, I'm going to see what's wrong with this machine, because it's supposed to give me 2. And that's how they see it. It's not good for patients. It's not. I tell people all the time, find a good, sole proprietor or family practice, or even if it's a group that's, 2 guys' name and that's it. It's not, I won't call any names, but so-and-so dental, that you had it, you go in the next town and you see it again. Because they don't really care about, your oral health. They care that you show up and keep making appointments.
Keep making money.
I was told when I first started in corporate dentistry, the most important thing I can do, or the most important part of the visit, was what they called the NV, the next visit. You don't let them go without another appointment. So whatever you do when they leave, there's an NV, next visit, in the chart. They don't care.
Wow.
Come back, spend more money. Come back, spend more money.
Okay. How has dentistry, being a dentist, impacted your life personally?
Oh, that's easy. When you set a goal for yourself and you achieve that goal, just the satisfaction alone, you feel like, I did that thing, So, and once you get there, I could run my practice into the dirt, but I'm still a dentist. I still got 4 degrees on the wall. You can't take that back from me.
And you can go to work when you want to.
100%. It's one of the fields that I'm not tied to a place or, you know, an institution. Like people say, why didn't you want to be a physician? And I was like, a couple of reasons. First one is I go to work all day and I don't have to worry about anybody dying. That was number one.
Mm-hmm.
And then number two, as a physician, most physicians, I know you can go to some small town and open a little family practice, but most are tied to a hospital. They have, you know, time they go in there, and that's how they pick up patients, how they grow their practice, and they got time they got to give there. Especially as a surgeon. I knew I wanted to be a surgeon. You don't go to Portal, Georgia, and see some surgeon sitting there like, hey, come on and get some surgery. No, you go to the hospital, and they call a surgeon in, and then you become a patient of that, and they do the follow-up care. So you're tied to that institution. I can go anywhere and be a dentist. I mean, I can go to a place that ain't got but 2,000 people and be successful. You know, I can apply my trade anywhere. So that knowing that gives you confidence, and that hanging over your head, you know, every day is like you don't feel so risky in some of the things you do, because if it blows up, I'm still a dentist. Yeah. You know, I can still make money. Yeah. You know, I'll reset and try again, you know, so it's almost like like baseball, you can strike out 7 times. And if you hit the ball the other 3, you're an all-star. Yeah. You're batting, you know, 300. Yeah. It's you get to go play in July.
Making millions too.
Exactly right. Think about that. Anything else in life, if you were a 70% failure, they was like, you need to find something else to do.
That's true.
But baseball, you know, so, you know, when you have the education background, and it's not even dentistry. If I decided tomorrow, I'm tired of looking at teeth and gums, tired of people coming in, you know, all these problems that they have made my problem when it's their fault, you know, and I'm trying to help them. They won't listen. They get upset because they think I charge. I'm done with it. I can go to university and teach.
Speaking of teeth and gums, what's the most craziest thing you've seen in someone's mouth when they came for an office visit?
Oh, man, I can write you a list. I mean, every week it's something. As a specialist, because I get, you know, the beyond, you know, so that's, you know, what a dentist might see once or twice in their career is a Tuesday for us, you know, so I had one guy had a pyogenic granuloma. It's basically it's a tumor. It's benign. So it pushes things. It doesn't invade. It's not malignant. And it's probably the size of a $50. And it wedged itself from one side of his bridge, which, you know, which is a missing tooth, and you kind of bridge the gap, to the other. So when you looked at it and it was leaking, I pulled his cheek up. It looked like maybe a dime. And I was like, oh, that's a big one. And then when I pulled the mirror down, this $50 thing was hanging out the other side. And I was like, this didn't happen yesterday, man. I mean, like, he's like, yeah, it's been getting bigger for a little while. I was like, you got to help me here. Define a little while. Probably about 16, 17 years. Whoa. He been putting it off. It'll go away. Right.
Wow. And you know that had to affect, you know, his overall health. It has to.
Yeah, everything. I mean, it's. I had one guy. This is actually a funny story. He comes in the office. I hadn't been out of dental school long. I wasn't even a specialist then. And his lower front 3 teeth was all he had left on the bottom. And it literally looked like a die, like, you know, like one dice, like a die. It was so much tartar that it was around, and he opened his mouth and he pushed it with his tongue, and it would flip back and forth like this. So I got a picture of it. I could probably dig it up and show you if you want to see. To this day, I think I saved it to my OneDrive. I was gonna the tooth. You could see the end of the root sticking out of the calculus. The only reason it hadn't fallen out of his mouth is the calculus had wedged a piece of gum, and that's what was holding it in. That's why it would flip back and forth, because the end and the top were out. So I was like, man, I'm gonna take this tooth out for you, and I'm not even gonna charge you, because it's like a joke. I mean, if you sneeze too hard, it's gone. So I pick up, you know, what I call a 15 blade, which is basically a dental scalpel or surgical scalpel, not just dental. And the guy's like, "Oh, what are you doing?" And I was like, "I'm about, you know, cut these 2 little fibers, and this tooth's gonna fall out, you know." And he's like, "What kind of dentist is it? You think you gonna cut on me? I'm not even numb." And I was like, "Man, if we got to go through the whole production and get you, no, they're gonna charge you for an extraction. I'm trying to, you know, save you $400, you know." And if I pinch you on the arm, it's going to be worse than if I cut this little piece of gum and this tooth falls out. So he wouldn't have, oh, I ain't broke. I got money, you know. So I'm like, hey, man, sure, whatever you want to do. So I have my assistant hand me the syringe.
It's a dead and everything.
It's less than a millimeter. It was so thin, in fact, and I am not making this up, that when I touched the tip of the syringe to dispense some anesthetic, the hydraulic pressure popped the tooth out into his lip, and I picked it up and sat it down. I didn't even like cut it, you know. And he's like, that's it? Because he saw the tooth. And I was like, yeah. He's like, oh, man, you good. Yeah, you good. I was starting to laugh. I was like, dude, why did you pay, you know? Because you hadn't even had a chance to get numb.
Yeah.
The pushing on it popped it out and didn't even hurt. I found it, but bananas. It looked like a die sitting there, and he flipped it back for his tongue. Crazy. I had one patient once. Oh yeah, that was crazy. I don't know if you're familiar with, like, if a patient has cleft palate or cleft lip, and you don't get a successful closure, you have a communication to your sinus in your mouth, and they usually wear a device called an obturator. And when you take that out, you can look straight in the roof of their mouth all the way up, to, past their nose. So I've seen, several patients. Matter of fact, I get a fair amount because they need surgery. They send them in, and then because you got to control water not to go up their nose. But this one particular patient who, when they took their obturator out, had this huge cyst, inside their sinus. And it was so large that it was almost occluding the opening for their cleft palate. And I was like, you need to see the ENT and have this thing removed. And they're like, yeah, they keep telling me I need to take it out. But the bigger it gets, doc, the less I have to wear my obturator. Like, sometimes I don't even put it in. And I'm like, that is not how you close your but in their mind, they're like, if it closes that hole, I'm good. And,
That's crazy.
They told me it's not cancer.
That is crazy.
But
Okay.
it's bananas, right?
As we get ready to wrap this up, I want you to give the audience and the viewers and listeners a hot seat moment, an embarrassing or uncomfortable situation that you've been in, and how did you handle it?
And there's a lot.
Just pick a couple of them.
All right. I had a patient once. Lean back, eyes closed, big gentleman, big boy. And I'm looking down, and we're getting ready to get started. And just out of my peripheral, I see it looks like, and it was, a spider. Made a web off the light and was coming down, and he's like, mouth open. So here it is. And I do not like spiders. I will not say I'm afraid, but pretty close.
Okay.
Like, I'm not gonna, embarrass myself. Like, like, hey, I'm 2,000 times larger than you, so I know I'm gonna win this fight unless you sneak up on me. So, but I'm aware I do not like them. So I'm trying to keep the thing quiet. I'm like, he don't know. And I can see the web, and I take, like, my mirror handle, and I know if I go too fast, like, if you get a spider web, they'll drop off. And so I'm, like, real slow and careful, like, and I catch the web, and he doesn't fall, and I'm like, God. And I keep going, and I get past his face, and I'm like, and it falls on the floor, and I step on it. So I'm super proud that I have,
Got this little spider.
Yeah. So, and no, patient's none the wiser. I take my foot off the spider, and my assistant, Judy, wherever you are, Judy, looks over at the floor and is like, and then looks at me right across the patient's face, and that's Black Widow, huh? The man was like, what? Black Widow? Comes up. I'm like, I just, went through all this, so it was a secret.
Yeah.
And she was like, yeah, you should have seen it. It was like, and I'm like, Judy. And that guy's like, no, man, y'all need to spray some bug. No, let me up, He left.
Wow.
Which I can understand. I'd have been in the chair. I probably would have too, but
Yeah.
I was like, oh, my goodness. I can't believe.
She just came and messed it up.
Oh, man, I handled it. It was great. It still gives me the heebie-jeebies seeing it come down when I think about it. I had oh man, I probably should tell this story, but I hadn't been out of dental school. It's my first job, hadn't been out long. First job. I mean, you can almost walk to the office from the school. I came out, got a job right there, and the gentleman I worked for, fantastic dentist, good mentor, kind of, gave me a lot of pearls that I still use today. But if there was a fund available for a patient population, he would take it. He did not care. So if it was a church that got together and put some money to pay for dental work for, recent release women from prison, he was going to take it, which is what this was. I don't think it was a church, but anyway, there was this organization that it funded. So this lady comes in, they don't have to pay for anything, and she needed a root canal on a lower tooth. So I'm like, hey, Miss blah, blah, blah. I remember her name to this day, too. We're going to get started. We got to get you numb. She's like, yeah, okay. So I take the syringe, start giving the injection. And she just hollers, like, ah! So I stop, well, sorry, everything okay? Yeah, I'm good. Okay, well, we still got to get you numb. So I go back. I'm thinking, some of the anesthetics on board, she should start getting numb, start giving the rest of it. Same thing. So I'm like, man, maybe, she was like, nah, go ahead and do what you got to do, doc. Because when you get done, I'm going to do what I got to do. And I'm going to see you outside. I was like, what? So I said, I think maybe this tooth has a little too much infection, this root canal today. Let's put you on some antibiotics and, we'll revisit this in a week or so. So the guy I worked for, we staggered lunch. So he would go, and then when he got back, I would go. So someone was always in the office. So he was about to go to lunch. And since I was not seeing this lady, I was like, hey, doc, hold up, I'm going to ride with you on lunch. He was like, oh, I thought you had a root canal. I was like, I'll tell you about it in the car. So we always went to this place in Nashville called Silver Sands Soul Food Place. Fantastic. It's still there. Anybody in Nashville should go. And we're sitting there eating, and I tell him what happened. He was like, man, you let that lady run you off your money. I'm like, man, she looks serious. I don't know. Matter of fact, I think the food made me a little sick. You think you just drop me off the house? I'll get my car, ride the bus back to the office tomorrow. I just take me home. And he was like, are you serious? And I was like, yeah, man. I'm serious. He's like, no, man, I know you're not sick. Are you afraid of this woman? I said, oh, man, my stomach hurt. So I convinced him to take me home. And, he's just jawing. I can't believe you. So gets back to the office, and they call me. And I'm like, here we go. He's like, man, don't you know that lady is out there pacing the parking lot? And I was like, I knew it. She was serious. And so it was kind of a running joke. So I come to work the next day, I'm like, she's not here. I'm not in the bushes or nothing. And I tell everybody stuff like, look, when she comes back, she goes on Lat's book, not mine. So they're like, all right. So a week or so passes, and I look at the schedule, and the lady's on my book. And I'm like, hey, we talked about this. And they were like, we thought you were joking, man. So I was like, oh. So now I'm going to have to see this lady. So I was like, well, at least it's like right after lunch. So I come in there, and there was one operatory that had like a back door. All the rest of them, it was one way in, one way out. So I was like, put her in the, 4, so if something happened, I can get out, So they're still clowning me. So I'm sitting in the operatory waiting for them to bring the patient back. And I hear a little commotion up front. And then all of a sudden through the door, and this dude comes in. He had to be about 6'10", because he had to look, lean under the door frame. That's 6'8". Bad haircut, funny eye. And he's looking at me, you Dr. West. I said, yeah. He's like, you Dr. West. I said, yes, sir. Can I help you? He was like, you the one that say, see ya, and I won't call her name. And I was like, oh, man, here we go. I said, yeah, I see her. And he's like, okay, yeah. And he backs up, he opens the door, and he snatches her in by the arm. He's like, now you get in that chair, and you sit there and don't move. They trying to do this good free dental work for you. You go ahead and messing up, talking about you going to get this in. Don't worry about it, doc. I got it. I was like, yeah, get in that chair. I thought she done went and got the boys to come get me. And I was like, oh, man. Wow. So he stands in the corner, his arms folded, and I hear the back door creep open, and I see Dr. Lattimer lean his head in. He was like, Dr. West, everything okay in here? I said, yeah, this is Miss blah, blah, blah's uncle. He came to make sure that she wasn't going to cut up today. And he was like, okay, very well. And like slid back out.
Wow.
So I finished the root canal. I was like, man, y'all was going to leave me in there. Y'all sent that dude down. Y'all didn't know what was going on down there. He's like, hey, man, he came and asked for you. And he said we let him go on. We wasn't no problem with that. Throw me under the bus like that.
Wow.
Give me a heads up.
Yeah.
But it worked out. It worked out.
That's good.
But
That's
you
good.
talk about, I mean, looking up at that dude in that chair,
I
I was
mean, you
like,
first get out of dental school too, you know?
yeah, I was green, you know.
yeah.
But even if that happened today, I'd be a little nervous.
Yeah.
I mean, that dude's a monster, man.
Well, how can people get in contact with you? Website, phone number, you know, give your contact information for the
Yeah, I've got
viewers
all
and
that. You
listeners.
know, we're legit business. It's Dr. West Perio, PERIO.com. It's 770-493-8500. But generally, your dentist would refer you. You just wouldn't find us on your own. But if you do need a periodontist, and they say, "Oh, I'm going to send you," by all means, you know, come on and see us. Because just because you got to refer, you can go wherever you want. And we get a lot of people referred somewhere else, and you know they find us. We take 2 plans. We're mostly fee for service, but we do take 2 plans. So most people we find who find us, it's because they say, "Oh, I went somewhere, or I got referred here, and I didn't like them, and I found you on the web, and you've got all 5-star reviews, and you know, so we figured we'd give you if I got to spend my money anyway,
There you go.
if I like you, we'll stay, you know, kind of deal." And most people do. So, but the dentist has to send you for a problem to a periodontist first, whether it be me or someone else.
Okay. Well, we appreciate you, Doc. And
Appreciate you having me.
as we get ready to wrap up, we are getting ready to be out on In the Hot Seat with WRP with Dr. Daniel West.